Many of the headaches, I'm not talking every case, not only headache or many of the sicknesses are attention seekers. So these people who have lived their life in pain, they program that my life has to be painful. See, WHO says more than 80% of the sicknesses are psychosomatic. It can be stomach issue or migraine or asthma. There are so many allied sicknesses which are caused due to the mental problems. There are two talks. One is the other talk to me, what others say to me, and second is what I talk to myself. What others talk to me, I don't have a control, and that is not going to affect me at all. What I talk to myself is the important thing. Unfortunately, what others talk, I repeat, and I suffer and I complain them.
Namaste and welcome to another powerful episode of HeadsUp Beyond Migraine, the space where pain meets possibility and healing begins from within. I am your host, Dr. Kurian, holistic migraine expert. Today, I am truly honored to welcome a legend in the field of education, psychology, and human transformation, Dr. Thomas George, chairman of Lead College of Management, a celebrated motivational speaker, and master in psychology and business. Someone who has empowered thousands to become the best version of themselves. Dr. Thomas has also been a guiding light for our Maitri program hosted by Ayush Care, helping our patients break free from emotional patterns and discover new perspectives on life and suffering. In this episode, we go deep into the mind-body connection, emotional intelligence, self-awareness, and how your inner narrative could be either triggering your migraine or transforming it. So grab a cup of tea and find a quiet space and tune in to what we are going to explore, that is a world beyond pills, a world beyond painkillers, a world where pain has wisdom and healing is holistic. So welcome, Toman, to Heads Up Beyond Migraine. Yeah. And Toman, you wear many hats, like academician, psychologist, and NLP practitioner, and so many hats you have, being a chairman of an MBA college. So what made you go deep into the mind aspect of it?
Actually, till my engineering, basically I'm an engineer.
Yeah.
That's the
I
fun
forgot
part.
to tell you that. Yeah.
Real crack. And then during my engineering, one of a nun in the convent directed me to study psychology at Thrissur.
Okay.
So every weekend, Saturday, Sunday, I used to go there. And earlier itself, I used to love people and dealing with them, talking to them individually. So there I learned counseling, the basic counseling course I learned. So I found, there can be many problems which can be solved. And then I started moving into the depth into the mind, which I liked. Probably that's the reason from engineering to management to psychology, and I went. And even my PhD I did in psychology only. So I love dealing with people. And there are many changes which can be brought to people.
So as you call yourself as a human engineer, so how do you deal with people, with regards to psychology, and how do you deal with people in management studies?
It's like a computer. A computer has got a hardware, the hard disk, the memory, the motherboard, everything, and the software also, which is the operating system also. Like this, a physical body, which has got the mind, which is the software. So if there is any problem with the software, however powerful the computer is, it will not work. So those small corrections we used to say by the name virus or maybe some mal programs or something like that. So those things, if we can correct it, then that is the best. So not because the human being is not powerful, but somehow the software inside, which is called the mind, has got some issues that we are not able to perform to the fullest.
Okay.
So if that can be worked out, then we can definitely use whatever our body is, physical body is.
So how do you see a relation between psychological traumatic experiences a person is going in his life and later on developing some kind of physical ailments?
See, WHO says more than 80% of the sicknesses are psychosomatic. Psychosomatic sicknesses means it is not the mental problems. But the physical problems, which we usually go to a doctor, a MBBS doctor to take a medicine, not a psychiatrist, not a psychologist. Like it can be stomach issue or migraine or asthma. There are so many allied sicknesses which are caused due to the mental problems. So, like for example, like you have a terrible headache. It's eating you like anything, and suddenly the neighbor sitting by your side in the bench or the chair falls down and the nose bleeds.
Okay.
What will you do?
Okay. We'll suddenly empathize with him.
And you do whatever is required.
Yeah.
What happened to your headache?
We forget him.
We forget it. And after everything, the person is taken to the hospital. Somebody comes and asks, what happened to your headache? Oh, I forgot. Yeah, that headache. So, it is more in the mind. More in the mind. I said earlier about the stomach.
Yeah.
The worst food a person usually eat is during the tour, the travel. Of course, some people get some stomach issues, but not that frequent. That also you see in the bus, everybody dances. Then somebody calls, you ate that food? Yes. Do you have any stomach problem?
I think so.
I think so. Then both of them will call the third person. Both of us are having stomach. Do you have? Yeah, I was thinking for some time, and the whole thing. This is very typically evident when the whole bus is moving. One person starts vomiting. Just like that, you can see so many people vomiting. Till then, what happened? So, and actually, when do they get the stomach problem? Is during the exam time.
Yes.
It is because of the stress.
It's psychological.
Psychological. And it has got nothing to do with physical. So that's why WHO says more than 80% of the sicknesses are psychosomatic.
As you were talking about the gut, have you ever observed, maybe in your students in your college or something, like there is something called as gut-brain axis.
Okay.
So there is a connection between gut symptoms and the brain symptoms. Or many patients, like many of my migraine patients tell me that they have gastric issues also. So have you ever seen such practical things in your life? Or maybe can you shed some light based on psychology that there is a relation between gut and brain?
Definitely it is. See, the mental traumas or whatever is, suppressed, or they come out. The easiest way for it to show out is as ulcers. As ulcers. So, like, the second is on the skin. But the first easy part is to show on the
Stomach.
Gastric. The gastric problems, and connected with that, the ulcers and the small bruise which falls in. Of course, we can treat it physically, but that's going to create problem again. Though I am not a great fan of Art of Living, Sri Ravi Shankar, but I know people go there who does the life.
Art of life. Yeah, art of living.
Art of living. Most of them get better with respect to asthma.
Yes.
It's just because of the breathing and the relaxation of the mind. And so, if even like I said earlier, when is your stomach maximum upset? When you are stressed.
Yes. And we also see most of the patients, who comes to me with migraine treatment and so on. Like we see most of the patients of migraine comes up with some kind of a background traumatic experiences. Maybe it's a unknown fault by their parents due to the time of during the time of parenting, or maybe something might have happened, some incident might have happened in their life, and we have seen a typical timeline correlation between the time of the psychological impact and the time of the migraine starts. So how do you correlate all these things?
I will use a word called similar situation. Similar situation is like during our childhood, we are not able to express something, and then we suppressed it. Maybe a teacher in the class, when you were very small, your neighbor told, like I lost my rubber and he stole it. And I said, I did not steal it. Get on the bench, and I got beaten. I'm talking about the old story, not today.
Yes.
So I was beaten for no mistake of mine. And then later teacher finds the rubber there on the ground, puts it and says, sit down, don't repeat it. And what immediately comes to her mind is to take a knife and stab on the teacher. but you can't express anything.
You just swallow it. Yeah.
And later on, when I use that word similar situation, later on, maybe in the class, teacher turns and say, who made that sound? The whole last bench go out. Out of the 5, 4 will simply walk out and 5th say, I did not do it. How can you put me around? People say, hello, come on. No, I did not do the mistake. Because he suppressed the old feelings. And when a similar situation came, the same suppressed feeling outburst.
Yeah. And it can even cause pains.
It can cause pain. It can cause anything. It can cause and it can cost also everything. See, many a time there is something which bad occurred. And the second part is I create a story out of it.
Yes.
And that story is more powerful than the
true incident, what happened.
So it's just like when all the public are there, I slap you. The pain will not last more than a minute.
But the feeling which I carry,
the mental pain you will carry for 5 years, 10 years, till, and you suffer. I always talk about forgiving. We keep an anger or some bad remorse, something bad about somebody, either who physically pained me, or I'll openly say sexually molested me, or anything like that. That person didn't left.
Yeah.
He went off. Yes. Now, that person is not suffering. Who did the mistake?
Who's holding that?
And I am holding it and I am suffering for somebody else mistake. And the part is, I have lot of anguish towards that person. And I expect that because I hold this anger and everything against him, the hatred, he is going to suffer.
No.
That's it. Mm-hmm. It's just like, I take the poison and drink, I expect the other person will die.
Yeah.
And that person has got no problem.
Yes.
Guilt. That's a very, 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 very bad thing.
It's always said that forgiveness is a gift that you give yourself.
Exactly.
And the moment we hold on to things, instead of letting it go, it causes not only the mental agony, also it can cause physical pains.
Absolutely. I had few cases where, there was a boy whose leg, every time the skin disease come and then it used to ooze out.
Yeah.
And then I went in depth, I found some traumas and some hatred, which I which I removed at that time. The next time it didn't happen at all.
Yeah. We have so many examples, like hundreds of cases come to us where we get a clear-cut timeline. Like just for the sake of it, I'll just share one example. Like once a lady came into me and told me that out of my 40 years of life, I never had a headache except for the last 12 years. So I just casually asked her, when did you get married? So she told me it's 12 years back. So there was issues with the husband, issues with the in-laws, and that all started after that psychological issues. So
it's like this. Usually what the child, whenever we are in the childhood age, that is reflected
on the adult
age. Like, see, right now, maybe in couple of past years, you maybe have bitten by a dog. We logically think, yeah, that dog bit because of the eye star. Like, it's okay. But if this dog need not bite, even barked at you when you were small, throughout your life you carry on with this. So whatever happens during our childhood, till the age of 7, maximum to the age of 9, they say from the time of conception, we hold it and then we live with that. It's just like I easily put it like this. When an elephant was small, it kept on running, and one day the man-otter came and tied the leg to a tree. He said, hey, going to tie me? He pulled it. No, pulled it again. Third time pulled it. And then the elephant programmed something inside. I can't break it. Today, elephant has grown very powerful and mighty.
But still, he holds on to that.
Yeah, if this is tied and put, I can't break. So this is how we also have put lot of traumas inside, the blocks inside. How much I have typical cases where a student says, I don't have voice. Yeah. I said, why? No, I don't have. And for some reason you make her scream.
The voice
Then-
suddenly bursts out.
And then say, it's not, is it my voice? Is it my voice?
They're not even ready to accept that it has come out.
Yeah, when we ask them to speak on the mic, he says, hello. Oh, no, my voice is. Then, like, it's, you would have listened, who cannot listen or who can't hear impaired. They speak very loud.
Yeah.
Because they expect others also can't listen. So here, just like that, when she hears her own voice, now she still reduces her voice.
Yes. And regarding this, the point which we were discussing, see, I have seen people who have a less kind of a self-awareness. So people who have gone through emotional traumatic experience often tell me that, no, sir, I'm not having an issue right now. She may be sexually molested, she may be bullied, she may be blamed, she may be having, bad parenting, but she thinks the logical mind says that all is perfect, all is well. And she goes ahead and tells me that, no, I'm not having any problem. So don't blame my psychology for my headache. So do you find a relation between the past experience in the childhood, which can carry on in the adult life, and what is the significance of child healing or inner child healing?
Okay, see, it's like, what will your mother do once power fails? You may give answers like lighting the lamp, taking the torch. Actually, what she does is fail outside and say, oh, there also no current, so fine.
Right.
So, what is the real answer? What is the ideal answer?
Yeah.
When I ask, are you good? Definitely
I'm fine.
I'm fine. I'm good.
Good.
It is actually, I want to be good.
Yeah.
It's not that I am good. We talk the ideal answer. Very recently, I visited an institute. Actually, the admissions are less and the whole, but they do not want to accept that.
True.
They say, yeah, it is there slightly less, which we will not. It's not like subconscious mind says, no. It has to be looking good. So it has to look good. So first is acceptance of the reality. Okay, it has gone down. What is the reason? What are the changes should we bring? All these things are the matter. But as long as we justify ourselves, nothing can be improved. Just like the case you said. Some cases I asked, what? He said, no, Thomas, please don't stop it. I have forgotten it. I said, if you have forgotten it, then why is it paining you? No, I don't want to remember about it. That wound is still inside. It's just like any foreign body gets inside. Like inflammations or something will come.
Yeah.
You take some powerful antibiotic, it will settle. But as long as it is there inside, it will come out somewhere. Until and unless you tear it outside and take it outside, it is going to create problems for you.
Multiple people have come to me facing similar issues, and they always tell me the same sentence what Tomin just said. Sir, can you just avoid that? I don't want to say, look there. I don't want to, listen to that. I don't want to go there again.
Yeah.
Because that I have already forgotten, and I'm moving at my life. So I don't want to go there. What is the real thing that we can help them by changing their perspectives?
Exactly. See, there are two words. One is emotional, second is logical. If they start thinking logical, then things are fine. But once they are in the emotional
Phase,
then it's very difficult. Like we have all the animals, including snakes here.
Yes.
Logically, we know a snake is not a venomous snake. It will not bite. Also, if you hold the head with the tail, it cannot bite. That is all logical.
Yes.
But emotionless, no. So, to bring a person from the emotional part to the logical part is very difficult. That is what we have to do. In psychology, we use CBT or RED. I mean, all these things, we'll have to logically make them. If I say this is logical, nothing. We'll have to. The best one is, asking questions.
Asking relevant questions.
Asking relevant questions.
So that they can reach there.
But sometimes, they flip with it. Finally, they'll say, you ask them logically, will it, this is water. Is this alcohol? No. Taste it? No, it is not alcohol. So you keep on asking something and finally, no, this can be alcohol also. So they come with blind because they don't want to turn to the other side. The uh, cognitive way only we can do. The other way to do is to put the person in the trance and then work it out with the
Hypnosis.
subconscious mind hypnosis or whatever we call it. In the trance, we can correct it. But see, what happens is even when we do it, once they wake up, when they come out, then somehow they try to do the other one itself. Like they try to use the consciousness. And it's like, we say you have your hand cut. Still, you feel that your hand is
The complete hand.
complete hand. So even if you're healed, like just like earlier I said, I have this much voice. No, I cannot have this much voice. So this is the problem. So we will have to, even when we put it in the subconscious mind, it is always better to logically make them think on
What is happening?
what is happening.
And in my last 20 years of experience of treating migraine patients, I have seen most of the patients are either underdiagnosed, misdiagnosed, or not even properly diagnosed. And uh, what the general pattern of our society is, we think that, with all respects to neurologists and ENT surgeons, we think that neurologists and ENT surgeons are next to God, and they just swallow that I'm having migraine. That is my identity. I'll have to live with it and die with it. Because we are all often taught from doctors that it is incurable. There is no way to get out of this. And even if they are healed out of the pain, even if they are healed out of the emotional trauma, they still think, why today headache is not, it should have come, no? These kind of thoughts, often bring them again to pain as soon as they stop the treatment. So they start the treatment, they find cure or they find healing and they find the symptoms reducing, but still they are suspecting, like, see, why pain is not coming, let me wait for the pain. That is the usual pattern that patients follow.
See, there's a term called pain pleasure and pleasure pain. So you would have noticed in the school days, there are some students who want to have pain.
Okay.
They keep on creating problems to get scolding.
Is it for attention seeking?
Maybe attention seeking, or basically with attention seeking only, or maybe to react, or there are many things like, they have some issue with the mother and he hates, so he wants to create problems so that the teacher scolds the mother.
Mom, yeah.
So so there are reasons, but now even if a new teacher comes in a very loving manner, you talk. Still, no, you're going to create problem. I'm sure the other teacher would have told you. Even if not told you, you will be. So we speculate
A lot.
and then we create our own frame of references. And we say, I know what you're going to think. I know what you are thinking. I know what. See, I have seen cases, like they come and I say, ask, no, I can tell, but there is no good. It is not going to cure. Even if we say some therapy or something, sir, do you think it will happen? I said, the first part, if you think you can't, then you can't.
What do you have to tell to people who think or who use the statement on a daily basis? The statement is like, I have tried everything and nothing works. And so I don't want to try you also.
And one more thing, they don't want to be healed also. That's the part. It's like, we say, when we have a small wound, it is going to dry. And
We just pick it up.
yeah, we scratch. Yeah. Little blood comes. No, stop.
We have that pain pleasure
There
also.
So we enjoy that pain. So these people who have lived their life in pain
For decades.
they program that my life has to be painful. And it is very difficult for them to stay out of pain. It's like in a dark cell, Dungan we call.
Yeah.
You put them inside, a person who lived inside that for 10 years. Once he comes out, he can't accept the light and the people and the stuff. No, they want it to be like that. It's like the people who kidnap and hold them for some time.
They don't want to come back.
They
Enjoy.
form a sort of
Biosensation.
affinity towards
What's that?
them, and then Stockholm syndrome is what is called. So they want to be in that. So what is our duty is to take them out for some time, enjoy them, feel them the fresh air and the freshness of life, and then let them decide. It's difficult, but it is possible.
Great. And there are many people who have shared an experience like, I've tried everything, nothing works. So my life is going to end. I have a patient who came from Bangalore who actually met a lawyer to find out whether mercy killing is happening in India so that she can legally commit suicide because she is just suffering from migraine and nobody is able to heal her. And when we spoke for hours together, I know basically our casing pattern is like a research-based protocol, which have almost like 100 plus questions, which we dig deep into the psychology of the person. So doing that, we could find out a series of emotional traumatic experience what she was going through, and she was not ready to change. So what can be done in such
See,
situation?
what happens is when we go back, this always result in a childhood experience.
Yeah.
Maybe they continue to. So what has to be done is go to that age and correct that problem there, and then bring them back.
That will always be done by inner child healing and psychotherapy
Yeah,
kind of.
something psychotherapy. Like go to that age, that the trauma which has happened in that child there cleared. It'll happen.
Okay.
It'll be cleared here also. For example, very recently in one of the program, one girl who's very silent, or that voice is not coming out, very timid, and never smiles at a person, never talks at a person, asked what happened. No, I've been bullied so much. By whom? My friends in the bus. What happened? They called me pittance. So we asked, what is the meaning of pittan? Small. Are you pittan? No.
But they just call me like
They
that.
call me. So then I have to see the rest. Always I say there are two talks. One is the other talk to me, what others say to me, and second is what I talk to myself. What others talk to me, I don't have a control. And that is not going to affect me at all. What I talk to myself is the important thing. Unfortunately, what others talk, I repeat, and I suffer and I complain them.
True.
See, somebody say, tells about me like, stupid. I say, oh, I am stupid and I'm really stupid and I do all the stupidity. Why? Because he told. Now, what do you say? Yeah, at times I do stupidity. It's okay. Then it's okay. But here what happens is what do you call, external locus of control. My control is with others. Outside. So whatever they say, I repeat to myself, and then I complain they said. It is I told myself is the problem. Simple. Nobody can hurt you mentally without your permission.
That comes also with the circle of concern, right? And which is outside our concern. And people always, all the migraine people tell me that mayonnaise triggers me, coffee triggers me, sunlight triggers me, or maybe noise triggers me. But when I give them medicines and the therapy which they need based on the holistic practices which we use, I see that actually these triggers were part of their life. They can even be the part of the rest of their life. But people are often afraid of stuff like, as you were telling about the snake. The moment they see coffee, they think that, okay, again, I'll get headache. These kind of experiences many people are sharing.
We do fire walking, walking on the fire. So we say what you do is dip your leg inside cold water, ice cold water for 5 seconds, 10 seconds, and then you walk on. Nothing will happen. And even without the chilled water, you can walk. But maybe there is a small burning sensation. Then somebody says, okay, I dip my leg inside, still I got the pain. That is mental. I walk through the ice, no. Then the pain should be there, no.
Yeah.
So this is it. in one of my sessions, like we put the person into trance who's afraid of syringes, pain, and then you prick the needle. The person is in sleeping mode and does not know. And then you take a photo without sound and then remove it. And then 5, 4, 3, 2, 1, 0, open your eyes. What happened? Nothing. What happened in your hand? Nothing. Are you clear? Just touch. Nothing happened. Then show the photo.
It's paining.
It's paining. Then it starts. So that's what we said. No, it's more in the brain than in the physical. And the more in the mind, I would say. And the brain obeys what mind says.
When I go deep into the migraine cases, we often find that there is a history of strict parenting where they are not allowed to mingle with friends, where even guys are not allowed to go out after 5 o'clock, where they are beaten up and, having so much of emotional traumas. And I often see that strict parenting have effects on emotional suppressions, and that has caused sinus issues. So, as a chairman of the Lead College of Management in Dhoni, we always say that this is a college from different planet because we don't have a gate, we don't have a boundary wall, and the chairman.
No watchman, no security, nothing.
Yeah, no watchman, no security, and the chairman is like one of the students here, and the chairman or a principal of the college is called Tomman by pet name. How do you look at in a different perspective where the strictness is it demanding or is it the freedom that you give your?
See, this question is like, what I have seen and grown up is right for me. For example, I think it's Eric Byrne who asked, when your mother was beaten by your father, why did she go inside the bedroom and cry with the face down? You may have a lot of answers, but the answer he says is, because when your mother's mother was beaten by your mother's father, she also did the same. Yes. So, suppose at that time, your grandmother slapped back your grandfather, probably your father would have got it. No. So, we tend to see and feel what I got is normal. So, here we are, see, a person performs not under stress. Somehow our parents have treats us that because their parents also have treated them that. So, a person performs creatively, intuitively, in a thought logical manner, not under stress. So when you are given freedom and then your mind is calm, that's where you can think logically, you can think creatively, everything comes out then. So the parents, two things. One is the parents should not be over strict. Okay. Because, and the decisions, so many people, even after the marriage, they come, I'll tell you what you do. Then where is the son or daughter going to take decisions?
Even which dress to wear or which hotel to go, your parents dictate.
So, that is the, the message to the parents. Don't be like, let them. Until and unless it creates problem for someone else. Let them. They say, they do, okay, how much a paint should be painted, that's it, right? So that should be the attitude which the parent has to take. And as far as kids are concerned, because my father was strict that time, now I need not carry that thing throughout my life.
But you came in from a normal academic college, engineering and psychology, where all the professors were called sir and stuff like that. And how did you implement such things in your college?
In between, I was doing a program called Turning Point. So there I was so close to the students. It's a 7-day program. And all the 7 days, it is from morning 6:30 to night 12:30, 18 hours a day. So you have to be one amongst them. So to become one amongst them and to understand, see, otherwise they look at me on the top. The students are here, you are on the top. They always look up at you. You come down, be with them, and then you can take them to any level.
How do you relate this with the healing experience of a patient who is suffering from migraine, where the doctor is dominant or the doctor is opening up and telling his own experience?
So, The doctor has to come to the patient's level, listen and understand the feeling of the patient. Otherwise, patient says, I am having pain. Doctor says, it's only your thought. Will not understand.
Sad to see that many patients tell me that you are the one who took like half an hour or 1 hour to listen to me first. Most of the doctors take about less than 10 minutes to get into the case, tell that this is migraine and it is incurable, and even some of the people have that I would call it arrogance or atrocity to lightly that this is incurable, and even I suffer from this and I take this pill.
Oh,
That is the way some of the doctors behave, and people are really getting pissed off with such kind of behaviors.
see, I know a doctor. Uh, she is like on high demand. So many patients that you can see big queue, an MBBS lady. The reason is go there. She'll ask your father, your mother, grandfather how and how is it. Like she knows and remembers everything. It's done on a personal level. And the people come out, I don't know about the physical part, mentally they come out very happy. When this is happening, the other one is automatically happening and gives them tablet, anything, placebo effect. Even distilled water or sugar ball should be fine. But then the matter is, as far as the doctor is concerned, you have to go to their level, feel their feeling. You can say, empathize, I understand your pain. I understand your trauma. Don't go logically. First, you go emotionally. Try to be with them to understand those feelings, emotions, and then ask logically, with this emotion, where have you been? And to what level will you be? It's like my father put me in a hostel. Why? Put me in a hostel is the right part. The rest is my story because he likes the other one. He does not like me. That is why he put. And then I create racket with them. So here, if you can make that communication, please go talk to your father and ask what is the matter. Then you will know, understand. In psychology, we talk about the 3-chair, empty chair.
Yes.
So close your eyes and think your father is in your friend. What did he tell? Fine. Now you go sit there. Now you're the father. Tell, why did you say? I told for the good of my son. Now come back. Now what is that you want to say? Close your eyes. Yo, dad, is it that because you told? I understood in the other way around. No, go there. What does father say? No, I'm so sorry. You took it wrong. And you come back here. Now you be the son. Mostly, in few sittings, they'll be sitting and crying. It was a communication or I don't know what all misunderstandings carry on. Yesterday, one boy came and told, Toma, what happened? In my previous college, I had a fight with a boy.
Okay.
We had lot of problems and he wanted to teach me and created lot of problems. Somehow I survived and I joined this college first. I saw him join this college. Now what do I do? I said, what do you do? I asked him back. He said, no, I can't. Either he leave or I leave. I said, you want to leave, you can leave. If he wants to leave, he can leave. But before that, just go talk to him. How can I talk to him? I said, just call him and say, hello, we had lot of problem in our UG college. Now that is a past story. Now this is PG. You are spending good money and there is a lot of things to be developed. Why don't we be friends? No, he will not accept it. I said, please do it. And he didn't. I did not meet him after that.
I'm just curious about the outcome, what happened.
If they go talk, see, how much is he suffering? The same amount the other person is also suffering.
Definitely.
The only thing is, that ego part to let down and say, I'm sorry. Most probably they are going to be the best friends. Maybe if there is one more podcast, I'll tell you what the answer is.
Great. And do you remember one of in our residential programs called My3, where you led a session where you were talking about perspectives, and one of our patients, a lady patient, was brought in, and she was given a snake from your college campus, and she was running away. And what have the other people to learn from that experience where she is afraid and frightened from the, just the, vicinity of the snake.
See, you remember that case. It is not only the snake she is afraid of. She is afraid of each and everything. And she has problem in everything. And she has problem with herself itself. And the thing is, one area, once you get corrected, now I have fear of a snake. That area is correct. That phobia is removed. It is not that phobia is removed. There are many other phobias which will be
Excellent.
like I told her, like I have my problem with my father. You communicate and correct it. Then I start dealing with many other people in a right manner.
Do you call this as generational trauma? Like, does it runs through families that my father did this to me, and maybe my grandfather did this to my father, and I always see that we get patients who have generational migraines, and they call it genetic.
See, it is genetic. It is genetic. As long as you live in their house. The same. I have a typical case. The mother calls me every day and say, yo, my son is saying not, I don't want to study and that, this. And son had lot of problems.
Okay.
Then I called him and then he said, no, I can't concentrate, I can do all those things. Then I said, see, when you, like, whom do you love most in the life? My mother. How is she? Very, very, very stressed. Because of me. So I said, like, what do you want your mother to be? I want her to be happy. And these actions which you are doing, is it making her happy or sad? Very tensed. And little later, I could correct him. Then only I came to know it was not his problem. His mother is the tension person.
That was her anxiety, and
that is what is percolating from there to here.
Yeah.
And he says, from my childhood, I have seen my mother like this. And he feels that is what is right. Now I am trying to tell his mother to be cool down, tone down. And then, he says, slowly I see a change. And now he says, I am so much relieved where he believed I can't be relieved. Now he is trying to make his mother understand that you can be relieved.
Yeah. See, when we talk such sense to people, people always ask me, sir, you know this, or maybe Toman know all these things. You have a PhD in psychology, and do I need to be a psychologist, or do I need to learn all these things to experience and understand such psychological things which can help me to evolve in our lives? Or we just have to go to some kind of a psychotherapy or whatever?
See, you cannot change anyone through counseling. I've been doing counseling for so many years.
Yeah.
And I know I cannot change anyone. And I can only aid when the other person wants to change.
When he's ready.
When he is ready, he says, I want to come out of it. Please help me. There is something which I can, just, tweak or guide, or little bit of work is enough. Probably they don't know. Like I'll put it like this. See, in my kitchen, we had staff, the cooks. And I brought one chef from KTDC, and his standard was very high. And now what I see is the other standard also have gone up. Now, even if that person is not there, others level have gone up. So we call it by name catalyst.
Yes.
An expert comes, helps them to run the flow properly, and then things become fine. So it is always good if you want to take a support of a counselor, anybody, like a psychologist or anyone. Do that and then try to come out of it at the earliest so that you can manage your problem.
The common question our viewers might have is that, are you both immune to all these things?
No.
Are you having emotional stress and...
Definitely yes. See, if you are a human being, until and unless you are not dead, you have it. Now, the question is not whether you have or not. How do you manage it is the question.
Okay. So, what are your rituals, personal rituals, where you find some kind of event or some kind of an emotional release, which is helping you to evolve and be successful or be evolving on a daily basis?
One is the ability to think from the other person's
Perspective.
perspective.
Other person's shoes.
Yeah, the empathy. Like, why is he reacting? For us, the biggest problem is, why all the rest of the people are behaving is like that is the question. And because of that, I am wounded. Okay. So, if we can start thinking about why, earlier I spoke about the empty chair. Why did your father behave? Now you go to his shoes. So, go to that person's shoe and ask why that person behaved. To an extent, you will get an answer there. Number one.
Yeah, please.
The second is to realize that people are different and we need to accept and understand everyone. If all are perfect, then what is our role? Okay. And now the third thing is, when I'm really upset about something and getting irritated, somebody comes, some of my students, I say, when I'm really irritated, can you come after 10 minutes?
You're getting some time.
I'm taking some time
Cool down and
to cool down, to breathe out and then say, okay. Otherwise, maybe I'll shout at him for no reason of his.
yeah.
So this, maybe like, a couple of deep breaths, spend your time, come out of the emotional part of the logic part, even if the other person is at mistake, but it should not affect me. Those logical reasonings can definitely make you more
Better.
stable.
Nowadays, these Gen Zs have a lot of knowledge or a lot of info. Along with Google is an old time one. Now coming to AI and Chat GPTs and whatever GPTs. And do you think they are more responsible? What is there to get them evolved? What is their attitude towards health, towards life, towards social settings?
As a doctor, today when I go to take classes for teachers, FDP, Faculty Development Program, the biggest complaint the teachers say, the students are more knowledge now. And I say the problem is not with you. The biggest problem is with the doctors. Because I know you prescribe a doctor, what is, this has got a side effect now. Is it not necessary?
That is true.
Hello, who is the doctor now? So, here, today's Gen Z students or kids have more knowledge. It's good. Let us take it in the positive manner because there is no other way. So, like, how can that be used logically is a question. The question was, I forgot.
See, I often find them more knowledgeable, but not sticking on to the consistency or to the, following it up with medicines or whatever treatment patterns they can follow it up. They are just they'll just try for a few weeks or maybe few days and they'll just tell, okay, it's not working.
Yeah, see.
The trust factor is less
Yeah.
in this kind of generations.
Yeah. Because the treatment is, I would say, major part is on the trust of the doctor. That's why you find some old doctors, old patients, they want to go to that doctor and you give very recently I was in a class and he had a problem and then, no, not this tablet, this is white, some other color I ate last time, I want that color itself, that shape itself.
She's very particular with that, format or whatever tablet.
So they said, no, he's an educated person. He said, no, but I don't think with this, I'll eat it. I don't know whether my sickness will go. So the trust is a very, very, very important factor. But there I'll tell you something very positive about some of the doctors who says, what's your problem? This is the thing, take and go. I found in some of the very good hospitals, they say, this medicine I am giving you for this reason. Yeah. It has got this little side effect, but it's okay. For that gastric problem, so I'm giving a ranitidine hydrochloride, something like that.
Yeah.
So this has to be taken before food because your stomach has to be. Now, you take that person into confidence.
That relieve most of the problems. Yeah. Most often my patients tell me that more than the physical headache or the pain they are having, they are traumatized by the comments of the other people telling that you are a migraine patient, you can't come to this party, you can't travel with us, we are going on a tour, and you are doomed for life. And people in the same family, maybe their siblings or parents or maybe partners, they ignore their pain, telling that this is just a headache. Why you're acting over? Why you are showing it off? Why you want to ruin your life with just a headache?
See, I'll talk about two things. One is many of the headaches, I'm not talking every case, not only headache or many of the sicknesses are attention seekers. It goes like this. When I was during my childhood, my grandfather was sick. So every attention went there. I did not get attention. Why? There is a reason, but as a kid, not logical, emotional.
Got it.
I didn't get it. And one day I fell ill.
I got the attention.
I got the attention. So now, when I fall ill, I get the attention. Now, if I want to get the attention,
I have to stay sick.
that is the part. So whenever I need an attention, I had some of the cases here. Of course, when somebody is sick, and then we understand, regularly it is like that. Then I say, ignore. So there's nobody is watching. Then why am I showing this? So they say, see, I'm not saying they're doing it consciously, but subconsciously they do.
We call this subconscious patterns.
Yeah,
This can also come from childhood experience and stuff.
definitely yes. So we have to break the pattern. Now, you were asking me about in the earlier case about the snake.
Yeah.
With a force I made her, I forced her to touch. Actually, in psychology, we call it catharsis. So, whether it is good or bad, there are different questions on it. But that is also one way of treatment. If she can be recovered from the sickness or whatever it is, that is fine.
What is the one takeaway that you have to share with the migraine patients who think they have an incurable disease, who think we have to live with this pain and die with this pain?
So, once patient feels this sickness is incurable and I will have to live and die with this.
That has become their identity mostly.
So, what you think you are, you are. What you think you are, you are. So that thinking pattern only need to be corrected. But when the thinking pattern also change, probably initially you will have to support with them some medicines. And then once they feel, they understand the story goes like this. One day, the husband said, I am dead. And he was on the bed. So the wife, children, okay, no, you are not dead, you are alive. No, I am dead, I am dead, I am dead. He'll get up, eat food, he'll not go for work. He says, I am dead, and he'll be on the bed. And then they brought somebody, a doctor. So the doctor asked, and he is dead. Okay. Well, if I prick with a needle from a dead person, will the blood come? Said, no. Blood will not come from a dead person. Blood will come only from a live person. So suddenly the doctor took a needle and pricked, and the blood came. And said, see, there is blood come. So he said, oh, I'm sorry. Even from a dead body, blood can come. So there are some people like that. But I think that is more psychological. Like with a little bit of counseling, maybe as said earlier in a trance, hypnosis or whatever it is. Along with the logical thinking, it can be corrected. It should be corrected. Especially as I really appreciate him because he has done a 1 week program, right?
Yeah.
As a doctor, as a psychologist, along with the medication, when this is done, more of their mental part was corrected. Of course, physical is also there. That's a perfect combination. That's something a life-saving thing. It's a great deed which you're doing to the mankind. And more people should know about it and try doing it. You are programmed that, many of you are programmed that this is not healable. But try doing it. Anyway, you have tried a lot of medicines and lot of treatment. It has not worked out. Try this one also. And I'm sure because I was associated with his one session and I found drastic change in people. Just like that, you also try and I'm sure it will heal you and you will be a very powerful person. In fact, you are destined to live powerfully. And let's do that.
And one last question. Does the pain teach people anything, or have the pain taught you something?
Pain definitely teaches, and pain should teach. I'm saying pain should teach. My mother is 84 years old. She had a surgery in the neck for some 10 years back. She is supposed to do something. She is not supposed to do something. Many a times she does the things which she is not supposed to, including the cobweb. She does it and the pain comes. I say, good. That is the gift by the God. And pain is something which tells your body that you take care of the body. Just like a kid, when he cries, when he wants something, not getting attention, maybe maybe sick or hungry or anything, cries and catches the attention. Like that, sickness or pain is something which tells yourself that, like, hello, I need more attention. But if it comes every time, that's a problem. Otherwise, a pain is a very good thing. That is an indication, even for those people who get fits,
Seizures, yeah.
seizures. So they get symptoms. It is going to happen.
That's a prodrome symptom warning them.
Yeah, warning them. And even when it is going to happen,
Yeah.
they'll feel something, so they sit somewhere.
Or they'll get.
Yeah. So similarly, these pains should be indicators of something, either mental or physical. Kindly pay attention and correct it. As simple as that.
Thank you so much, Taman. Thank you for nice having you here. It was a really enlightening journey last 1 hour. I'm sure my viewers have got a lot of information along with the insights that you have shared. Thank you so much for it.
Thank you. Thank you so much.
That was a truly soul-stirring conversation with Dr. Thomas George, filled with new insights and powerful truths. If you have been navigating migraines or any form of chronic pain, I hope today's episode gave you new tools, perspectives, and above all, hope. Remember, healing is not just about what happens to you in your body, but about what you believe, what you think, and what you feel. Start observing yourself. Start listening to what your pain is trying to teach you or just trying to tell you something. If this episode resonated with you, do share it with a fellow warrior who needs to hear this message. Subscribe to Heads Up. Until next time, keep the heads up, keep your heart open, and keep healing. Bye.